I appreciate the opportunity. I wear 3 different hats for the system. I do the video technology, also the network engineering, but as it pertains to today's content, we'll be talking about the network voice infrastructure and what we've taken. It's been quite the journey. I think a lot of people initially thought I was a little crazy, like, why would you do this? The phones work fine. It's 100-year-old technology. And then I got some stern warnings from really technical people, which was, man, if this doesn't work, you're going to get in a lot of trouble. So it was tough those first couple of months that we tried to convince people that this was the journey we wanted to make internally. But once we got that buy-in, we went through a vetting process, both from an equipment perspective, but also from a carrier perspective. So hopefully I can cover all that today and raise and spark some curiosity. So I'm really happy to be here to mingle with all of you. So put together some quick slides. Certainly not a PowerPoint by death, but I'm going to cover these high level and really get into the nuts and bolts here shortly. But some of the business drivers that we looked at was we really wanted to leverage new technologies for a number of different reasons. We made a very sizable investment before I even got to Advocate, and then through the 11 years that I've been there in our VoIP infrastructure. And it just seemed a little, kludgy that we just kind of ignored the carrier space and really didn't focus in on that at all. So there was curiosity there. What SIP look like? Can we do this fun stuff that everybody keeps talking about? Certainly security is always top of mind now more than ever, but back then, TLS encryption, secure RTP, absolutely things that were being pushed upon me by our security director and our CISO at the time, who also happened to be my boss, to say, what can we do, if we went to this model? When we looked at the hardware, one of the things that really came to light when we started planning architecture was, embedded firewalls. And if it met the criteria of someone who's real pain in the butt for me, which is my peer and the director of security side, and he said, look, I really like what at the time it was Sonus, what the Ribbon product has. And I'll have a funny story to share with that his engineers did not pass their first round of security training to be a certified engineer on the product, which made me laugh a little bit. So I said, tell that to your Palo Alto folks, that it's a pretty darn good product. But I still razz them to this day. And then we wanted to look at ways in which we could start to look at SD-WAN offerings. How do we leverage that same infrastructure to route voice traffic over, right? And then the thing that maybe wasn't an initial driver, but is absolutely a driver now, is TDM trunking conversion. So I don't mean the traditional PRIs, but I'm talking about POTS lines, I'm talking about alarm lines, I'm talking about fax lines that I don't know if you guys are getting the warnings I'm getting, but they're insisting that the tariffs are going to take place. They're going to start hitting us hard. And I said, okay, so how do you want me to remediate it? And they offered me about 4 pieces of equipment at the tail end of a SIP trunk to do media conversion. I said, well, that's cool, but we can do it with a single card that we're going to add to our session border controller and just have a much cleaner, cut process. So along with that came some additional cost savings that weren't in our initial estimates. So that's been fun. It's a pain in the butt, but it's a great journey to be on because you're now fully leveraging that initial investment that you made. From a flexibility perspective, we're call control freaks. We're getting requests all day long for number portability, right, type concerns. Sorry, I know it's a 20,000 DID, call range, but I need this number. It's an important number, and it's not going to point somewhere else, which is typically a contact center solution. So you're breaking up what was a homogeneous dial plan. And in the old days, in a PRI world, where you might port from carrier A to carrier B, that's a problem. That takes time. It's often not nimble enough or quick enough for us to meet the demands of the business. By being able to stabilize that on SIP and then literally placing a ticket with our chosen vendor here in Coeo and saying, yeah, we're not going to bring that in internally to our own network, but that's actually going to point to our cloud contact center solution. And we'll get into that peering relationship there. And then the flexibility of being able to, on a fly, change our business continuity and disaster recovery models. They're pretty static, but from time to time we do have to make changes, especially in this day and age where most buildings that we occupy that are not medical centers, they're shadows and ghosts of what they used to be. So we are changing modeling pretty much on the fly. And again, with the hardware that's in place today and the technology that's available to us, we're not waiting on a carrier. We're not. So that's been absolutely crucial to our success. Next slide, please, Brian. So some of the selfish things that we wanted, as if the prior slides weren't selfish enough, was the self-supportability and to be able to scale whenever we needed to. And I think Kevin will attest to this, but we don't have a whole lot of carrier involvement today. The model, when I took over the telecommunications piece 11 years ago, we were completely reliant on what can and can't be done based on archaic rules, archaic processes, and something that I like to call as the black hole. Put the request in and you wait. I couldn't give any ETAs. We couldn't provide any kind of strong customer support. And that weighted heavily on us, right? I have a very caring team of engineers that we don't want to be sitting on waiting on requests for 30 days or longer. And then we wanted the ability, in addition to that, to quickly add capacity or maneuver capacity as need be, right? That's this whole centralized SIP diagram that we'll show you here shortly. Hopefully we'll be able to show you how well we can scale and move things around. So by adding capacity and being able to pretty much dial up the wick whenever we needed to with a pretty quick operational change on our end and or some involvement from Coeo. So we're not completely independent of them. But that was key, right? To be able to deliver the demands of healthcare pretty much immediately. The economics. While I didn't originally know if the ROI, was going to really vet out, what we found was that, and we purchased the equipment, right? So we didn't lease, we didn't do a holistic cloud approach. We have very robust data centers in which we wanted to leverage. The way that they're powered, the way that they're managed and engineered, we light our own direct fiber into them. We felt it was robust enough that we can build this internally and manage it like our own little carrier network. So that ROI actually wound up paying itself true in roughly 16 months. So I double checked my numbers last night. Originally, we had proposed a 36-month ROI on the original investment of the data center, session border controllers, and then those that were local there to our hospital campuses. The telecommunication savings, again, we'll talk about this in a later slide, but much to my chagrin, 25% and a minimum savings on that initial turnout. And that turnout, that project really was scoped around the hospitals. We didn't touch our clinics. We didn't touch our tier 2 sites. That number is specifically for the hospitals. As we started to look at TDM replacement, narrowband circuits, right, POTS lines, things of that nature, and then hitting our SD-WAN environment into our clinics, that number is probably overall closer to 40%. So we had a voice spend in the state of Illinois alone, mostly with one carrier, in excess of double-digit figures, 10+ million. Huge amount of trunks, huge amount of traffic. We overbuilt, right? I'm sure some of you that are in healthcare today, when census is high and you're going to get into that 4th or 5th PRI, most of the time it's dormant, right? We could see that in traffic studies. So we took that into account when we rebuilt the voice network. It allowed us a chance to clean up our inventories. Again, not the most fun process, and those people deserve many meals and many drinks on the house because of the efforts that they had to do to scrub CSRs and make sure that we're moving numbers that needed to be moved as opposed to numbers that were there and nobody really knew what they were pointed towards. So a lot of cleanup. Again, you're going to get a substantial reduction in unused services as well. And then the chance to finally get least cost routing capabilities. Recently, we implemented a management layer over our session border controllers and I'm sure it's more than a management layer. I don't have my propeller hat on, so forgive me, but our our PSX EMS environment, which we turned up in 22, we started it last year, it's been turned up this year, provides us the chance to provide least cost routing more than what just the PBX has allowed us to do, right? So in the state of Wisconsin, I've got everything. I've got Avaya Red, I've got Nortel Blue, we've got Cisco, we've got Alcatel, we've Vodavi. I can name some wingdingers from the 1990s that some of you would just cringe at knowing that we have the inventory there. Regardless, my point in that is that I can't do any least cost routing there unless we had some type of system that said, hey, look, that's in our dial plan, that should not go out, right, through the public service telephone network. So that's our goal. We've been doing it now, I think, Craig, it's been 3 months, 4 months, but obviously the more mature environment is able to leverage the SIP infrastructure, and we're working towards that. So that's been fun. I don't even have a number as to what that could potentially save us from providing that layer of internal call control. Brian, next slide. So how we did it, and this is just a chalkboard sketch. We didn't want to get too in the details. We certainly can if anybody wants to take a deeper dive later on or through the Q&A. So what we asked of the many organizations, carriers, is how would you deliver this? Talk to me around geographic redundancy. Talk to me about carrier redundancy. I didn't want a single-threaded, fiber to touch another fiber if it was part of an HA environment. And we did that. So we leveraged the Chicago Oak Brook location as a primary, secondary, depending on what month it is, right, when we rotate. And then we used their data center colo in Denver to be the secondary source. That comes into one of 3 data centers. Initially it was 2, and that funded all of the efforts for Illinois. And then as we now start to build the same model in Wisconsin, we now have one in our northern Wisconsin data center to funnel SIP services to the hospital campuses and more. But traditionally, we go after the hospital campuses first. So we have the data underlay has redundancy. So we're not using any particular data vendor more than for one leg of that delivery model. In each of these data centers, we went with a 5410 series box, and they are configured in an HA environment. So if A fails, B takes over, vice versa. If there is, again, the data underlay, we have that redundancy built in where from A it'll go to B. In the worst case scenario where for whatever reason the data center becomes an island and I don't have connectivity to it, we can actually reroute on any one of the other 2 data centers in the same fashion. So we'll still have HA pairs in each of those with carrier redundancy. I think we're slowly getting there in Wisconsin, but the hardware is there, the licensing there's, the concurrent SIP call paths are there. So what we did when we built that centralized SIP model, so it delivers into these data centers. From there, it leverages either a dark fiber network or multiple WAN connectivities back out to our major campuses. And what that allowed us to do was to say, look, all this overage, all this waste that we built into the PRI infrastructure out at the individual sites, we didn't build it for that. We built it for, I thought was a worst case scenario. We haven't even maxed out from some of our initial trunk projections. So we built those concurrent paths to be able to route down any one of those sequences back to the sites. In the event that we need overages and whatnot, we were able to play around with round robin. We did percentage-wise distribution over the network if we need to avoid capacity issues. And Kevin was instrumental. I think he had to drop off the call, but he was instrumental at being able to help us determine, what made the best sense from and it's not really a DRBC, probably more of a business continuity perspective. But if we were to ever hit a high census of phone calls for whatever reason through this infrastructure, we've yet to see it. Knock on wood, we've yet to see any failure in the 6 years that it's been up and running. And that's not to say we haven't had a failure. The user never noticed, not a single drop call. Now, we did build in some redundancy out at the sites. So if the site, for whatever reason, became an island, and it has happened, and has no longer connectivity to the overall dial plan that's being presented by one of the 3 data centers, we have BGPR in place, just like we do for distributed traffic between the 3 data centers. We call it a 4th route, call it a 3rd route, whatever you want to call it. We actually have a dedicated circuit. So we use an SD-WAN type connection back into a localized SBC. It's a much smaller SBC because it only cares about trunking that unique hospital's needs and requirements. That's trunked at about 75% of what the original numbers of trunks that we had there. Again, we've used it a couple times. It has happened. We do have to reestablish calls when that happens, but those are done in less than 3 seconds. We've tested it, both unplanned and planned. So we had a case where a fiber spur, there was a fire in the city of Illinois that cut the aerial fiber that was also a spur to Illinois Masonic. So Masonic within 3 seconds was back up and running. Yes, we lost those calls that were active, but again, they were up in 3 seconds. Dial tone out, dial tone in. So that dial plan redistributed itself to the 2Ks on site. What's great about that is that 2K was built on the layer 2 network that the VoIP PBX system is on. So we have our own little mini network there that was designed in that if we lost IP services to the phone system, our digital and analog phones still work throughout the campus, right? So we take it very seriously from an overall design perspective. So that's internal to Advocate Aurora's infrastructure. There are some external factors, and Coeo was chosen through Avtex as well as Genesis and our NICE and contact centers. We have different flavors after the merger, right? We haven't gotten down to one, but they are the chosen carrier for not only Avtex as an integrator to Genesis, but by Genesis as well as NICE and contact. And we actually trunk and peer. It's a bring your own provider in the cloud. So again, we didn't have to give up any of our dial plan. Number portability, not an issue. Simply just some programming changes, obviously, on Coeo's side to be able to peer directly into them, which has been phenomenal for us. I can't tell you how much of a help that was during COVID. Yeah, it blew our minds that we were able to do what we were able to do. And it's taken for granted, right? It's a phone. Pick it up, it should ring, it should work, kind of like your light switch, right? It's a standard utility. So, much kudos there. Again, I don't want to spend too much time on trying to explain what we did or how we did it, but Brian, if we go to the last slide, well, we could certainly take deeper dives depending on the questions that come through. So outcomes and lessons learned, we significantly exceeded the original ROI projections. I talked about that. Again, we chose to buy our gear. We manage it. We have in-house engineers, heavy training, hard training. We talked about our security experts failing the firewall portions the first time they took them. And we've sustained that level of training. We exceeded our initial cost savings projections, and we continue to just drive down our telecommunications costs. I'm not going to share our SIP costs compared to PRIs or POTS lines, but I'm sure you could quickly do the math and realize how much savings there are there. Probably the biggest thing that our auditors and risk and network security appreciate about is the impermeable service delivery model, where we, knock on wood again, my on-call for engineering, network and telecom engineering in Illinois it's usually about the network and not about this voice SIP infrastructure, sadly. But it's been fantastic. Our DR plans, when we test every single year, it's an independent auditing control faction within HIT at Advocate Aurora, and we pass with flying colors. The quick and nimble internal service delivery model has been a godsend. I can't tell you the amount of tickets the reduction in tickets that have to be generated to a carrier, and again, the waiting time that it used to take to process some of these changes has been exponentially reduced to almost nothing. We can make changes on the fly without any disruption whatsoever, and a very quick commitment time frame. One of the interesting things has been our TEM costs actually went down. So we just renewed our telecommunication expense management contract, and not only did it reduced while adding the state of Wisconsin into the mix. And that is largely because the complex billing of circuits in the old days, comparative to the way we have things set up today with our partner and collaborator, it's been a godsend. So they're not touching the amount of paperwork and the amount of billing inquiries that were once kind of pervasive, right? And they're still there because there's still plenty of work to do. We are not anywhere close to finalizing this model, and particularly the state of Wisconsin. It's a little bit of the wild, wild west. Had no idea there were as many carriers there. So I'm quickly learning that, especially comparative to the Chicagoland area. And, you know, take your time as you go down this road to look at the carrier offerings, look at the equipment offerings. We looked at 3 different products. You know, obviously Sonus Ribbon was the one we chose, but we did look at other products, and we went with what we felt was best of breed. And I'm not just saying that because I'm on the presentation, but you know, they've been a tremendous partner to us, and as has Coeo, right? Find the right carrier, and find the right SBC that works for you and your organization. It's been fantastic for us. Again, we're fairly self-sufficient, but you know, there's still a big job that has to be done for Coeo and Ribbon to deliver, you know, top quality products and services so that we can look real good to our customers. And then, you know, my last little note there is I wish we would have done it sooner, and we certainly can't do it fast enough in the state of Wisconsin with some of the quick hitting tariffs that are coming our way. So